All right, this is Arab Talk with Jess and Jamal on KPOO San Francisco 89.5 FM. This is Arab Talk, and I'm Jess Ghannam.
And this is Jamal Dejani.
And we're broadcasting again from our quarantine states, acknowledging the shelter-in-place order here in the state of California. We're going on to the fourth and fifth week now, Jamal, and the situation for the coronavirus continues to exert a devastating impact, not just in the United States, but globally, with over 1.5 million cases and tens of thousands of people who have perished at the hands of this pandemic.
Yeah, that's right. I mean, you can't be optimistic because according to all the reports which you just mentioned, 1.5 million worldwide, almost 100,000, so I think it's over 90,000 deaths. The United States, 433,000 cases, 15,000 cases dead in the United States. They were speaking today, I listened to Governor Cuomo talking about the peak in New York, which should be today, according to some estimates. Now, this is the question about bending the curve, because if it is a peak in New York, then you start talking about maybe, seeing some improvement. Also, California, Gavin Newsom has been reporting that things have been stabilizing, and especially in the Bay Area, which we have lower numbers than the rest of the nation. But the other troubling thing, just that we probably should be talking about, is the inequity in the way this virus has been hitting people. The CDC released a demographic report, and a snapshot of this for the COVID-19 in March shows heightened numbers of those with underlying conditions are African Americans, mostly men. And so it's hitting African Americans and Latino, actually, basically black and brown people, major imbalance in the way, we can talk about it, from the socioeconomic point, crowdedness, lack of maybe health support, and then, of course, the worst fear is for those people who are incarcerated in crowded jails. As you know, the United States is an incarcerated nation. We have more prisoners in the United States than anywhere else in the world.
Those are really important points, Jamal, and I just want to emphasize one in particular, which is also the differential death rate of the COVID-19 virus in the United States and worldwide that shows complete and really disturbing racial and ethnic disparities. You're right in your first point that the numbers of people that are getting infected with COVID-19 are disproportionately people of color, African American, Latino, and other brown people. But even more disturbing from my standpoint is the death rates also show significant disparities. So, for example, in New York City, 70% of the people who have died from COVID-19 are people of color.
Well, it's also exposes the socioeconomic inequality in this country. That we've been talking about, because poor health, as you know, is also related to diet, aside from access to good doctors and hospitals, and also there is neglect. In a way, the focus is not there. Let's focus more maybe on Wall Street. Like if you look at, for example, New York, and I've lived in New York more than 10 years, not all boroughs in New York are equal. Not even zip codes within Manhattan are equal. The Upper West Side, the East Side, and so forth. And it sounds to me like the focus is mostly, on wealthy areas, and keeping what to do about the economy. And then when I was watching some of these doctors in the poorer neighborhoods and hospitals. And this is where you see the shots of the, sadly, the refrigerated wagons, hitched to the back of the hospital where they ran out of space in the morgue to put the people dying in them. It's a very sad scene, to see that.
I think that's right, Jamal. And it's not just New York City. I mean, New York City, we see a real ugly, exacerbated picture of the health disparities. But if you go to Louisiana, if you go to Alabama, if you go to the Deep South, those disparities, as I mentioned before, over 70% of the deaths are African Americans. Same in Detroit, same in Chicago. So you have these urban centers. And the mayor of Chicago, Mayor Lightfoot, even said that when she was looking at the number of deaths among African Americans, was saying that these numbers took her breath away. Well, it's great that it took your breath away, but what are we going to do about it as a country?
Well, no one wants to take responsibility. I mean, we know that from the get-go, Trump was in total denial. Then he started to point the finger at China, calling it the China virus, then blaming the different states. He recently blamed the World Health Organization, for not giving us enough notice, and which, by the way, blaming China now, a new report, that's another thing I'm sure you're aware of, that there is now new data coming from the Icahn School of Medicine at Mount Sinai and the NYU Grossman School of Medicine, which says basically that the initial virus spread in New York, not from China, even though we know it originated in China, but rather came from Europe. They've just recently conducted a study and said with more than 80,000 cases and 4,260 coronavirus deaths, according to them, basically the epicenter New York, that the two projects basically have been circulating, is saying that the likelihood that most of the travelers that came to New York were from Europe and other parts of the United States, because we were behind like 2 months basically on this. So that kind of changes things, kind of the perspective, how the spread of the virus and also early calculations and early reports were wrong.
And I wanna make 2 points about that, Jamal, which are really important. Point number one is that reports are coming from the New York Times and the Washington Post that Donald Trump and his administration were briefed as early as November of 2019 that this coronavirus had the potential to devastate not just China, but the entire world. And this was part of his daily presidential briefing as early as November. So he was apprised of this as early as November 2019. Then in November 2020, one of his secretaries, Secretary Navarro, who is a complete buffoon, by the way, he's not a physician and is giving advice about hydroxychloroquine. Having said that, he also wrote a very scathing memo to the President of the United States in January of 2020 saying that this coronavirus thing had the potential to devastate the U.S. economy and cause hundreds of thousands of deaths.
I want to talk a little bit about what's going on overseas. I'll talk a little bit about the Middle East. The Middle East so far, the numbers that I've been receiving, that in the entire Middle East, that there is more than 100,000 coronavirus cases. But this number is very low.
I wouldn't believe it.
Yeah, we know that. So this number is very low, but that's how it has been how the news has been disseminated. But Iran, of course, is the worst. That one story that kind of jumped at me, that more than 600 Iranians have died from the consumption of high concentrated alcohol, believing it protects against the coronavirus. People are getting desperate in Iran. This is according to a story from the Iranian semi-official Tasnim news agency, quoting a person, in the judiciary system. His name is Ghulam Hussein. Ghulam Hussein Ismail, and he's saying some Iranians are resorting to drinking neat, N-E-A-T, alcohol. And the number has been increasing and reaching disturbing figures. 3,000 people had poisoning because after drinking this toxic drink, and 600 of them died.
Well, Jamal, that's really devastating to hear. I think we need to be extremely skeptical of any data from the Middle East. I could tell you, I've been speaking with my colleagues in the Middle East. Jeddah, for example, in Saudi Arabia is completely shut down. And the people that I spoke with in Saudi Arabia believe that the numbers that are being portrayed by the kingdom are significantly underrepresented. By the way, parenthetically, Ramadan starts in a couple of weeks. It's going to be interesting to see how that all plays out. I mean, Mecca has been shut down. What this really points to is how social media has been used to promulgate, if you will, all of these crazy ideas of how to treat the coronavirus, which is actually resulting in more people getting sick and dying. So
exactly, because this is the example what happened in Iran. We know in a country like the Islamic Republic of Iran, drinking alcohol is forbidden. That through social media, I don't know how and who gave this idea of drinking neat alcohol, that you're going to cure yourself from the coronavirus or protect yourself from the coronavirus, that you have these people getting alcohol poisoning and dying.
Yeah, that's just as bad, unfortunately, as this last Sunday, which was Palm Sunday, where you had pastors in the Deep South in Texas continuing to tell people to come to church and worship, and giving the idea that worshiping and a belief in God could overcome the coronavirus. I mean, spiritual connection is awesome, but do it through social media. All these ideas about what cures the coronavirus, we have to say this on Arab Talk every time, Jamal. There is no cure. The treatments have not been scientifically proven. The vaccines will not be available for a year. The only cure, the only treatment we have for the coronavirus is hand washing and social distance. That is it. That's the only thing that we know scientifically can really stem the growth of this virus. And if people, we have to tell, I know our listeners who listen to us regularly kind of get this, but if there are people out there who are not regular listeners or viewers to Arab Talk, do not believe any of the hype on social media. If anyone tells you that they have a cure for coronavirus, you should run away. There are no cures. We don't even know. This gets by. I just need to say this, Jamal, because it's so disturbing to me. When you hear Rudy Giuliani and Donald Trump touting chloroquine and hydroxychloroquine, both of whom, by the way, have a financial interest indirectly with the company that makes it, touting this as, what do you have to lose? It's not based on science. It's based on anecdotal information. And for people to believe in these anecdotes and to believe this idea, you've got nothing to lose. Well, what you've got to lose is dying again, or getting sicker, or, taking a medicine away from other people who actually need it. There's a lot to lose. There's a lot on the line here. So I'm tired of these
some people might need it for the real thing, like malaria. So
exactly.
Everybody trying to kind of stock up on these drugs recommended by Dr. Trump.
Yeah, it's ridiculous.
That he's a doctor. Another story just that we've talked about last week, which is the story of, and there is a correction in this, and I'm one actually to correct something that I've actually fell for that story. And that's a lesson about social media, because not only social media now has been putting out these crazy stories about cures, but also there is a lot of misinformation out there. People just putting it for fun or to score a point or what have you. But last week we talked about the Israel's health minister, Yaakov Litzman, and he did indeed said that, the return of the Messiah will be the cure and the salvation, will get us out from the COVID-19 crisis. And this is Israel health minister. Well, 2 days later, after he said that, 2 or 3 days later, he and his wife, Mr. Rabbi Litzman, and his wife, Shava, tested positive for COVID-19. And so, of course, he was in close contact with Benjamin Netanyahu and other ministers. And so that's why basically Bibi Netanyahu went to self-quarantine because of the exposure to Rabbi Yaakov Litzman, who is also the health minister. Then there was a story that said that attributed to Yaakov Litzman, saying that this was a divine punishment against homosexuality, and it caught rapid fire. It was all over the media, and from credible media outlets, including MSN, MSNBC, and other things. And although, by the way, which I have to say, just to correct the record, although Rabbi Litzman, he's a homophobe and opposed the LGBTQ equality and said all kinds of derogatory things against, and is against, of course, same-sex marriage and whatever. He actually never said that. So just to show you, he actually didn't say this. But this was actually a story that was covered throughout, the world, not only the Middle East and Israel.
By the way, you're listening to Arab Talk on KPOO in San Francisco, 89.5 FM. We're broadcasting also on Facebook Live at Jamal's Facebook page, Jamal Dajani 2. You can always go to our website, ArabTalkRadio.com. You can listen and watch all of the podcasts. And as you can see, Jamal and I are continuing to honor the science-based recommendations on social distancing, and we're doing our show, remotely from our respective locations in Northern California. I did want to mention, Jamal, I'm very concerned. I've been speaking with my colleagues in Gaza, and, Gaza is a particularly worrisome situation. We had 2 people who had been to Pakistan who came back to Gaza who had the COVID-19 virus. It looks like there are about 15 plus people who have been infected. They continue to do contact tracing. The thing that we all worry about Gaza are a number of things. It's a prison. So like any prison situation, there's the greater likelihood that, if people are infected, it will spread. But more importantly, the embargo by the Israeli military and government of medical and health supplies. If people get sick, there's only a handful of ventilators in Gaza, Jamal. If people need to be ventilated and they need the medications to recover from ventilation or to use ventilation and then to recover, it's just not available in Gaza to the extent that it's available in other parts of the world. So the situation in Gaza right now is very critical. I will say that both in Gaza and in the West Bank, Palestinians, we have to give Palestinians an A+ for their social distancing. Actually, they are listening to science. There have been a number of fatwas also from religious leaders in Palestine, both Muslim and Christian, by the way, who have encouraged people to stay at home, not to go out, and to engage in social distance. So at least in the Palestinian context, from the information that I've been able to get, it looks like people are at least following the instructions of self-quarantine and isolation.
Yeah, well, I mean, the main problem in Gaza, as we all know, is that Gaza faces severe shortages of equipment, any type of equipment, medical equipment or equipment for diagnosing, of course, the novel coronavirus. and they suffer from medicine and food shortage. They've been very innovative. We talked about this last week, how they now changed some of their factories to manufacture, for example, the masks.
Right.
Because they can't import any. China has recently sent I don't know the number, how many thousand masks to both Gaza and the West Bank, because the United States pretty much has cut all financial aid to the Palestinian territories. U.S. aid basically does not function anymore ever since Trump came into power and the so-called deal of the century. Also, UNRWA has been cut off by the United States. They only receive part of their money through the United Nations, so they've cut their services. They're not as they don't have the impact that they used to have. So they have to rely basically in Palestine on self-sufficiency, because if we're talking about today, for example, past 2 days, because it's the Jewish religious holiday of Passover, Israel, with and without the coronavirus, they usually lock the West Bank during those holidays.
Right.
So people cannot travel, but this also affects Palestinians' healthcare and medics, because it also disrupts their their travel between towns and villages.
That's right.
And at the same time, Israel stopped to provide, or actually they provided very little except for some areas in the Jerusalem suburb. So if someone in some of these villages that has been isolated by a checkpoint and a roadblock, if they needed a doctor, they can't get a doctor.
That's right.
And they can't be transported to a hospital.
That's right.
So they actually have the siege now. They have the Israeli siege, plus the coronavirus, plus lack of equipment and medicine. On the social distancing side, they've been doing a very good job. They understand science, and it was very important. For example, I can't recall even during times of war and wherever, when the Al-Aqsa has been
That's
closed,
right.
or when the Church of the Holy Sepulchre has been shut down. And so, as you know, Sunday is Easter for Catholics, because, there is also will be followed by Orthodox Easter a couple of weeks later. And this is the time when everyone gathers in Jerusalem and Bethlehem. Thousands and thousands of Christians come to celebrate the holidays along with tourists. You can actually... last time I was there during Easter was, I think, in 2016. You can't even set foot in the old city. This is how crowded, and you've been to the old city, and these are narrow alleyways, ancient staircases, nooks and crannies, and that kind of thing. You basically, in normal days, you cannot avoid not being touched by someone. Sometimes you get shoved to move out of the way and wherever. So that physical contact is part of the experience walking in the old city, and now the old city is deserted. So this is the difference, and I think I'm glad it is in this case, because the Palestinians basically have been abandoned. They've been abandoned by the international community, and they've been abandoned by their occupier, which holds a legal responsibility to provide healthcare. So, and even, the so-called deal of the century and the annexation of Jerusalem, up till today, even though Israel claims sovereignty over Jerusalem, they treat Palestinian neighborhoods totally different than the Israeli side in West Jerusalem. So garbage gets picked up there once a week versus 3 times a week in West Jerusalem. The streets don't get cleaned up as much. And also, other services are affected there.
Well, Jamal, I think, ironically, Palestinians, because of the, 71 plus years of brutal occupation, unfortunately, know how to shelter in place. So, in some ways, because Palestinians believe in science, they have a long history of sheltering in place to protect themselves and their families. Thankfully, it's coming to their advantage right now during this coronavirus. Another piece of news, by the way, from the Arab world and Middle East, Jamal, is that Saudi Arabia and UAE announced a ceasefire with their brutal attacks on Yemen. And the reason they have done this ostensibly is because of the coronavirus. Not that they're worried about killing, thousands of Yemeni civilians, men, women, and children, but they're ostensibly afraid of their forces contracting the coronavirus. So there's been I think it's a 2-week ceasefire, if I'm not correct, Jamal. There looks like there's going to be a 2-week ceasefire, which seems kind of crazy to me because, this coronavirus is going to be going on for months and months and months, but at least there's a ceasefire with the brutal carnage that Saudi Arabia and UAE are engaging with in Yemen right now.
Well, I attribute this to two things. One, of course, the coronavirus, but also because of the oil prices that
Yes.
Saudi Arabia has been engaged in this war between its basically OPEC and Russia, a price war, I should say. And as you know now, you can buy probably in the Middle East, the cost of water is more expensive than oil. So now they're losing billions of dollars in revenues that they were spending on that war effort. So that's why I don't look at it as just a coincidence. It has both the coronavirus, the fear from the coronavirus, but also has a financial aspect. Saudi Arabia has been losing billions of dollars, cannot finance this war for that long. And that's the other reason. And by the way, and the third reason, of course, it's unwinnable. But I'm waiting for them to realize that this is an unwinnable war, and they've just been burning money like paper, basically, to keep bombing the poor Yemenis there, killing women and children.
Well, this is going to put the Crown Prince in a his back is already against the wall. MBS is in a really bad situation right now. So we'll see what happens. Jamal, I'm sorry to switch gears right now because, in terms of our time, but I cannot leave an episode of Arab Talk without really showing my appreciation for the wisdom and brilliance of Jared Kushner. He continues to show himself as being brilliant in medicine, diplomacy, and now in logistics. I just don't know what the world would do without Jared Kushner. Jared Kushner, again, Jamal, is responsible for a complete collapse of the so-called peace plan and peace efforts in the Arab world and Middle East. It's been a catastrophic disaster. We will only see that. In addition, his advice to the president, his father-in-law, early on that the coronavirus was just being hyped by the media, contributed to Trump's delusion that it wasn't going to be that bad and that he could just economically fix things or ride things out. Now we're finding that Jared Kushner was involved in single-handedly getting supplies to medical supplies and personal protective equipment and intubation devices to Republican donors in New York who were sympathetic to Donald Trump. So he has his finger on the supply chain. And when this part of the history of the Trump administration and all the damage that it's done to the economic and moral fiber of this country and the world, Jared Kushner will be at the center of this historical analysis of the moral and intellectual ineptitude that he brought to the table. It just is amazing to me, Jamal, how he continues to have a leadership role in all these areas where he has absolutely no expertise whatsoever.
Yeah, I mean, this is a crazy story because you're right. I was like reading about the story, and so well, of course, just going back now. By the way, I haven't been seeing him in the briefing in the press room after that statement that he issued, like, this is ours versus like the federal government versus the states. I think they're making him disappear for a little bit after he just came under attack because of his stupid statement, frankly. And then to find out that he's like, now, you're right, he's just basically hooking up people, kind of like a drug dealer.
He is
That's how, he's like hooking up friends of family and donors, with their own personal, supply that's supposed to go to basically to hospitals that are in dire need for these respirators and masks and whatever. And then there are other things. I don't know if it's attributed to him and whatever, but we've been hearing also a lot of stories how the United States, I don't know if he's the one behind these things, have been taking over some supplies that were destined to go to other countries. France has accused the
Right.
U.S. that they've had, for example, I think a plane on the tarmac in Shanghai heading to France, and then 2 Americans walked in, I presume working for the U.S. government, and offered tripled or quadrupled the cost, and diverted that shipment to the United States. Another story I heard similar to this also about another shipment going somewhere else in Hong Kong. Same thing happened there.
That's right.
So I don't know if this is part of his work.
But you know what Jared Kushner could do, Jamal? Because he's a slumlord, and he and the Kushner companies own properties all over the United States for people who are economically disadvantaged. If Jared Kushner had any ounce of moral conscience about what's happening right now, what he could do is give everybody a rent respite.
Are you kidding me, Jess? Are you kidding me? In fact, the story just a day ago that they had, that it's actually, I think, published in the New York Times, that the Kushner company, real estate company, has been issuing eviction notices to tenants.
Well, that proves my point about the moral bankruptcy of Jared Kushner and his family. And, when I say his family, that goes all the way to his wife and the White House, because at a time when people should be giving mortgage and rent holidays and vacations, for 3 months, give people a break. What the Kushner companies appear to be doing is issuing eviction notices to people, putting them on the streets during the middle of a pandemic. So if people have any kind of idea of what this administration, what their intentions are, economically, with healthcare, politics, whatever, that story should tell you everything you really need to know. That rather than giving people a rent break, they're basically issuing eviction notices.
Actually, just a correction, that story was in The Intercept, and this is, people can read it. It just came out a few days ago. His family real estate company, which owns and manages thousands of apartment units, they continue their aggressive eviction practices and debt collection lawsuits. They're filing lawsuits as Americans wait for government relief. So they're the first ones. We've been hearing like how many, now there is a law that you cannot actually, I don't know if it's applicable in the rest of the country, but in California, you cannot file for eviction or a lawsuit for 90 days. There is a moratorium on this. They were the first people. So they've had these stories, at least 15 tenants in New Jersey and Maryland. They've already received they were served with the lawsuit to kind of vacate the premises. As Governor Phil Murphy in New Jersey and Larry Hogan in Maryland declared state of emergency, the Kushners did not stop from sending eviction notices.
Well, that's why we are so grateful, Jamal, that we have Jared Kushner at the center of power for the Trump administration, helping guide this country through. You know, as we kind of look forward, Jamal, because the Trump administration and President Trump have a big problem. 17 million people have applied for unemployment at this time. That number is only going to increase at a dramatic rate. People are going to lose their jobs. The economy, despite what you hear, is gonna go into a deep recession. How long? We don't know. People are losing their jobs. People are going to lose their homes. People are going to lose their livelihood. And whatever, $2 trillion package that the Trump administration is touting to help small businesses and people, those monies are still not getting to people. So the best that the Trump administration can do right now, Jamal, is say, well, instead of 100,000 or 200,000 deaths, we're going to have less than 100,000 deaths. That's their main talking point right now, which is unbelievable to me, because even if we have under 100,000 deaths, that's still an enormous number of people who have lost their lives, families who have been decimated, who have lost loved ones and have lost their livelihoods. It's just devastating. That's going to be their main political angle, because I don't see how this thing economically or in any way, no matter how much money you're going to pump into the economy and go into debt, I don't see how this thing gets resolved before the November elections. So I'm going to throw out, Jamal, this crazy idea that there's going to be some funny business going on with the November election. That's what I'm worried about. I don't know what it is, because people are advocating for mail-in, ballots nationally instead of it being a state-by-state thing. The Republicans want to shoot that down. But I do fear some funny business going on with the November elections.
Well, I mean, I think Trump will do anything and everything to get reelected. And the dealing with the coronavirus, even this whole approach as far as opening the country by Easter initially or by the end of the month, it's all driven by popularity ratings and also his own personal wealth and interest that, so what, we might lose few more lives, but we'd rather make money. And the focus, even when you think about the stimulus, it's less directed at small businesses. I mean, small businesses are getting some relief, like up to $10,000 for payroll and things like this. But most of the money is going, as usual, and as has been done in the past, to the big banks and corporation, and then very little is going to filter down to the small business, even though they're going to make you believe that something like this is going to happen. But and now we know who's the Democratic candidate nominee, which is now Biden. So Trump can focus all his efforts is trying to paint a rosy picture that he has saved the nation from total collapse. And maybe I'm with you, even though you changed your mind, that this would be his ticket for re-election.
Yeah, I haven't changed my mind yet, Jamal. I haven't. I still think he has as good a chance as before to be re-elected. But the level of moral depravity that he and the Republicans are going to have to go to spin this to get reelected, and the amount of voter intimidation or voter manipulation that's going to go into it is going to be, widespread throughout the country. you had the Supreme Court making decisions, basically supporting the Trump policies, limiting elections and voters being able to get to the polls. Also supporting some of his, draconian measures on the border with Mexico in terms of asylum seekers. And one other thing I forgot to mention, him firing the IG, two IGs recently who are attempting to oversee how the money is spent on the $2 trillion that the government is throwing at big banks and big corporations. It's, the politics of it are really ugly. And it's the same kind of Republican game plan, Jamal. It's like 9/11, when people are so emotionally and physically exhausted and distraught, you see the Republicans making these policies, whether it's Cheney policies, Bush policies, that are really antithetical to the democratic process. What is happening behind the scenes, Jamal, right now, while people are dying and our healthcare system has become overrun and on the verge of collapse, we see Republicans making changes behind the scenes that are really going to continue to devastate people's lives. And by the way, the people whose lives are going to be devastated are the Trump supporters. And I don't know if they're going to be able to really fully appreciate and see this as we get closer to November.
Well, on this note, we are coming to
an end
of another show from our shelters in place. Stay at home.
Wash your hands.
Wash your hands. Stay at home. Watch Arab Talk online on our website. You can access all of our archives at arabtalkradio.com. And we'll talk to you next week at the same time.
See you next week.